know it's not quite 9 o'clock, but acknowledge everyone that is coming or is here. And so we get started. The nature of this is such that I think that we, the leaders of the community in this area of public health, and the leadership needed to jointly discuss this. And so with that, I'm going to not follow the total procedures of the regular council meeting, but I do want to start by invoking the aid of Almighty God. If you bow your head, we'll have a word of prayer. Heavenly Father, as leaders of this community, always, each day, we should exercise our very best judgment in handling all the details of being good leaders. But especially now, when such an epidemic appears to be upon us, we ask you to give us a special blessing of understanding and wisdom to try to be even over and beyond our ability usually to be the right kind of leaders and to put together the type of policies and procedures to protect our people and your people. So as we gather, let us be sober, mindful, thoughtful, and instill within us the ability to make the right decisions, we pray. Amen. Let me preface this, and I won't be as long as y'all accuse me of, but there's a few things I thought I ought to, and I think most of you have probably already read this. But at any rate, and I've just highlighted some things, and it'll take me just a minute or two to go over these. But I think I would be negligent if, in case all of you haven't gone over this, if I didn't point out a few things that I've highlighted for this. This is a highlight here. What are local governments empowered to do under a declaration of a state of emergency? Political subdivisions of the state, including cities and counties, are authorized and empowered to make, amend, rescind such orders, rules, and regulations as may be necessary for emergency management purposes, so long as such are not inconsistent with any orders, rules, and regulations promulgated by the government. Cities have the power to self-government through the Georgia Constitution. Cities have the power of self-government through the Constitution. Police powers through statute have legislative power to adopt clearly reasonable ordinances, resolutions, or regulations relating to property affairs and local government for which no provision has been made by general law which are not inconsistent with the Constitution. And there's just 2 or 3 more of these, bear with me. But I think each of these points you need to, of course, this is available to everybody. You can get it and read the entire thing, but I'm just highlighting a few things. Additionally, cities often have provisions in their charter concerning emergencies, which allow the cities to establish procedures for determining and proclaiming that an emergency situation exists within the city and to make and carry out all reasonable provisions deemed necessary to deal with or meet such emergencies. Therefore, it appears the Georgia courts have held that in times of emergency, local governments have inherent powers to protect the public. The United States Supreme Court held that the city regulation enacted an emergency to address viral epidemics, in this case it was smallpox, was within its police powers. The courts further held that the right to protect itself against an epidemic or disease which threatens the safety of its members, the city has this power. In summation, both cities and counties have inherent police powers to take emergency action of the state of emergency actions in the state of Georgia. Additionally, the United States Supreme Court has held that a local government utilizing its police powers in a reasonable manner to prevent the spread of contagious disease does not violate the Constitution. Okay. One or two more. I'm trying to give you the benefit of this notice that we've all got. Let's do this. I want to do local governments and press, that any decision to close restaurants or limit them to takeout or to impose curfews would be a tough one. In such actions would be potentially would create an economic turmoil. Talking about the governor. He also urged local officials to do what is in the best interest of their communities to keep the people safe and stop the spread. That's pertaining to Governor Kemp, as previously indicated. I left off the first sentence there. But Governor Kemp has cautioned us about imposing actions that will create economic turmoil. He further said that groups of 10, unless groups of 10 may gather, unless such gatherings would assure. Let me go back and get the thing right. I'm trying to rush it more than I should. Governor Kemp informed the state of measures that he would take to close all bars, nightclubs, and ban all gatherings of 10 people or more, unless such gatherings would assure spacing for at least 6 feet between people at all times. The last paragraph over here, I want to be sure to read it and then go turn it over to y'all. And here finally, and then we'll take it. Chairman Carter, we're glad to have you here representing the county, and we're indeed pleased that our health officials are here to help us. Then in final, and then we'll go from there and try to do what I ask the good Lord to help us do. Local government leaders are the ones on the front line and the ones your constituents will turn to if things get worse. Therefore, local government leaders are strongly encouraged to provide avenues for communications with their constituents, to provide information to our constituents, and to take actions necessary to save and protect lives and to stop the spread of the coronavirus. I think we all pretty well knew that, but at any rate, now the council, and I'm turning, this happens real quick, I haven't been able to make copies for everyone, but through us, throughout here, I've got dispersed various ordinances that have been passed by other local governments, and each of these commissioners up here, I've handed some out. I think the Barry, do you mind sort of repeating what you told me last night about your opinion of your circumstances with the hospital?
I'd be happy to, Mr. Mayor. And I think if you don't mind, if I could preface it with a couple of statements as well.
You preface it anyway. Listen, we're here to help. Would it help you if he came to that mic? Or can you hear him okay there with your recording?
Hopefully it'll pick it up.
Okay, all right, we're in.
I'm happy to come up if you'd like.
No, whatever, if you be more convenient, whatever you want to do. But again, if I don't say and ask the right questions, how about y'all giving the right answers anyway? All right, go ahead.
Sure. I'll just for the benefit. Just a couple of things I wanted to make sure everybody's aware of, and I think sometimes you just have to hear numbers in order to put it into perspective. So far, worldwide, 435,006 individuals as of 7 o'clock this morning have been infected by and confirmed infected by the virus. Of that, it's resulted in 19,625 deaths. In the United States, 55,225 individuals have been infected as of 7 o'clock last night. In the state of Georgia, 1,097 individuals as of 7 o'clock last night with 38 deaths. Just to also keep in mind in regards to my comments that I'm making, at this point in time, and all I did is pick those specific counties that were very close to us. Lawrence County has 6 cases, confirmed cases. Coffee County, 2 cases. Ben Hill County, 1 case. Telfair County, 1 case. Tattnall County, 1 case. So I think, first of all, my first comment is, as we sat here and watched, in my opinion, in horror of what was happening in China, and then what started happening in Europe, the United States basically sat here and did nothing. There has been no preparation as far as advancement of supplies and the needs in regards to the healthcare community or anything of that sort. Just now, since it's actually on our front doorstep, has anybody really started doing anything to protect the populations here? This is a silent enemy, has been pointed out by some of our politicians and others. There are a lot of folks that are right now carrying the virus that have not been detected and will not be detected in some cases, or in some cases with a 14-day incubation period. It could be a couple of weeks before we know that they're infected. So the more those individuals are out in the community and in the population, the more severe and the issue can be. When I'm looking at this as an issue in regards to this community, obviously the first thing I have in mind is the more people that get infected, the more people that are going to be at Jeff Davis Hospital, and the more I'm concerned about the welfare and well-being of my employees. Because they're the only ones that are going to be addressing the needs of those patients at that point in time. We are in full-fledged emergency status at the hospital. We have quarantined areas that are isolated by barriers within that facility at this point in time. We have been trying to ramp up as much as we can on supplies. Supplies are tremendously difficult to get our hands on. And when you can get your hands on them, you would be shocked what people are doing out there. Right now, N95 masks, which are the masks that provide at least a 95% barrier to particles. In the past, prior to the virus, we were paying 30 cents per mask. Right now, they're asking $10 a mask. You know, it's just incredible what we're having to deal with. So not only, when you're talking about financial stability, not only are you concerned about the community's financial stability as it relates to this, how can a hospital be paying prices like that in order to get supplies we need to make sure our staff is not infected? And again, you know, Albany has about 30 of their employees right now that are infected. 1 death as a result. That's hospital personnel. So we take this very seriously. I've got a few folks back here. We meet every day, trying to discuss what the status is and what we need to do. We make changes every day. We currently have 23 tests that are out as far as individuals that have potential symptoms or symptomatic that meet the criteria for the virus. Unfortunately, again, not being prepared, our testing is taking anywhere from 5 to 7 days to get results. So, you know, even during that time period, we have staff that are having to be fully equipped as far as personal protection equipment, those masks, gowns, face shields, gloves, all the things that you need to wear to protect yourself, which is already starting to make an impact on our quantity of supply. And that's waiting just for those tests to come back. So we've got a lot of concern on the healthcare side, and my recommendation is for this community to do whatever is necessary to abate the potential of that virus spreading throughout the community. Eliminate social gatherings as much as possible. You whether it be a voluntary curfew or a voluntary termination of business within the community other than essential services, I leave those decisions up to you as the decision makers. But my recommendation, shut things down as much as possible, prevent the movement of individuals and the gathering of individuals as much as possible, and trying to take care of the circumstances and issues that we currently have. Appreciate your time.
Thank you.
Stay there if you would, please, sir. And I'll try to start a few questions. How many ventilators do you have in your hospital?
We have 3 ventilators.
3 ventilators. But let me ask you this, even if you got some tests back and one of your patients was pronounced with the virus, do you have a safe isolation place within your facility to house and treat such patients?
As I said, we've created barriers. We now have, we currently have 5 inpatient rooms and 3 ED treatment rooms. So as individuals come in, they'll be quarantined in those treatment rooms in the ER. If they are deemed to have the symptoms and need to be put in as an inpatient, we have 5 rooms that are sealed off. 3 of those rooms are negative air pressure, where we can vent those particles out of the facility in order to reduce the infection. We have 1 ICU room that has negative air pressure, but only 3 ventilators. So if we get beyond that, then we're searching for other facilities that can take these patients. And as you see, the increase, let me just also state, 2 days ago, the number in Georgia was 607. 2 days ago. You heard what I said now, 1,097. So that is 400 individuals, over 400 individuals, that in 2 days have been confirmed to have the virus. And we're nowhere near the apex. This has got a long ways to go up before it starts going down. So that's my biggest.
All right, another question, and I hope you other folks will help me now, but I'm just trying to get our hands on the topics that will help us finally make a decision. It seems too that you being a leader and having tenure at other local regional hospitals and all, can we as a region find out an area where we could maybe quarantine and isolate? For instance, we bought a hospital over here not too many months ago. We've got it occupied with it, and it's busy. But you see, if that building were available, all those rooms, could we, if a community, if a week or a month things got worse, we're not going to run off our doctor, I assure you, but I'm just using that as an example. Could we find a place such as that and get it equipped with all the people that are so equipped with equipment and protective gear and ventilators and to isolate? I say one of the health people saying, no, that won't work. At any rate, what will work? What are we going to do?
With what he just said, it is in our best interest to stop that before it gets there. So if I may, I prepared a statement that I would like to hopefully persuade the council, if you'll listen to it.
Well, that's what you're here for, sir.
I'm not speaking from a standpoint of fear, but wisdom in hearing what and comprehending what our healthcare professionals are saying. On 3/23, as you highlighted, Governor Kemp signed an order limiting gatherings. Currently, there are no confirmed cases, nor has there been any positive cases in Hazlehurst or Jeff Davis County. With that being said, if or when, rather, a confirmed case or multiple cases should arise, the following should be noted, as he just said, to us. Number 1, public health and healthcare systems may become overloaded. Number 2, elevated rates of hospitalizations and deaths. 3, other critical infrastructure such as law enforcement, EMS, sectors and transportation industry may become affected. Number 4, healthcare providers and hospitals may become overwhelmed. Number 5, at this time there are no vaccines to protect against COVID-19 and no medications to treat it. Number 6, as awesome as our hospital is, it doesn't have the resources or adequate staff to take care of patients who become infected in our community in a mass number. Number 7, if it spreads here, healthcare professionals will be quickly overwhelmed, putting themselves at greater risk. Number 8, leaving non-essential businesses open may put our greater elderly population at even greater risk. Number 9, people with greater underlying health issues such as cancer, heart disease, diabetes, HIV, immunosuppressed patients are at a more dangerous risk. Number 10, while discussing the resources at the Jeff Davis Hospital, we have 3 ventilators on site, many larger facilities already at maximum capacity. Number 11, with all the above in mind, that leaves nowhere to transfer patients if or when there is an outbreak of COVID-19. So from what we've been informed, A, it lives on the surface for days. B, it is spread much like the flu. C, many are not symptomatic for 5 to 14 days, and it can spread before symptoms develop. I pray that we be a proactive city rather than a reactive city. With this crisis in mind, the city of Hazlehurst are obligated to our citizens to offer them the best protection for their safety, health, lives, and loved ones. I believe it to be our duty to act in the best interest of our city by executive order to close businesses that are defined as non-essential businesses. Many municipalities are already taking action that are deemed necessary to the health and safety of citizens in the city. We have a list of them. I don't think we have any other alternative than to take this action that has been brought before the council.
You've done your research and made a good presentation, Commissioner. Thank you.
Thank you.
All right, any other questions while we've got our hospital administrator in front of us? Well, he's here addressing.
Not, excuse me, not anything that was resolved, such not, but I'm curious about one statement you said of the price gouging of the mask. When you find this price gouging like that, do you report that to the state?
We reported to the state district attorney.
Thank you. I'd like to hear that part. But I do want to commend John. You've done well with your research that is there. And I think we need to do what we can to protect our citizens, but we do not need to abuse our citizens. If we are going to put any qualifications on one, we need to do it on all. In other words, we don't want to be closing down and forcing those of small businesses to close by orders of the city when we're not doing anything with those that are large businesses that are still running full force.
Feed everybody out of the same spoon.
Yes.
It's better to have people quarantine at home than to have them go up to a facility that can't handle it. I don't want to shut a business down, but I think if we put this order in place, maybe there's something the city can do on the back end of it to help them with their water bill or late penalties or I mean, if we're going to take something from them, let's offer something back to them to help them.
We're going to need to be able to help our small businesses in particular.
There's a number of things instigated my worry and struggle with this last night in initiating this, but I want to share one with you, and there were several. One lady called me, I can tell it was a lady, pretty sure it was a lady, she called Mayor. If I've got to close my business to only take out orders, why are some letting customers in? If I've got to penalize myself, I said, well, man, who is it? Never mind that, and she hung up. So I know some business was exercising voluntarily what they were supposed to do. And this person was upset that some others were not. That's just one of the things that hit me, and they wouldn't even identify themselves.
I've talked to people in other places that have become affected by this, and they have basically prayerfully requested that we take whatever action that is necessary proactively to prevent this spread.
Man that's been in the health field the longest and got more experience in dealing with health issues on this council sitting there with his mouth shut. How about open up, Mr. Johnson?
He wouldn't put you on the spot.
No, I wouldn't. I
But
just did.
my thing is, you and I have been talking for the last 3 or 4 weeks, so honestly, the hospital, about 6 years ago, we started prepping for this type of thing. And Jeff Davis would never be able to handle what will happen. I mean, they can do all they can, but I don't think that they're gonna be able to handle it. But now, how are we gonna handle it if you go to heaven? Let's say you have 30 people in this county that test positive. How are we gonna track them? That's my concern. Jeff Davis is gonna be on the front line no matter what. And we have to back Jeff Davis up, because people gonna come to the hospital, whether we like it or not. That's where they know to go. And that's what I said at that time, and I'm saying it now.
Chief, take care of that problem at the door.
I'm gonna come to the people that can help me. So, how can they help you all? We can shut the city down. Yes, the city has that power, but it's gonna happen. And it's for us to be not overreactive, because if you get overreactive, you're gonna make matters worse. As the president was saying the other day, you can overreact and underreact the same. But my thing is, what plan do you got in place, or we got in place, that when it happens, how you gonna control it?
And think about this.
One second, if this happened, have you all tapped other resources to help back you up to do that? If the city come in, you can have a total curfew of this city and take everybody off the street. I think we eventually gonna have somebody with that virus in this city, because we got thousands of people. But the problem is when you get it, how are you going to take care of it, is my concern. See, but I know we prepped 6 or 7 years ago, and I know at that time we had things in place to take care of certain mass casualties and viruses. So let's just don't overreact. That's what I'm saying. But you got to do something. You just can't sit here. I'm gonna tell you, people that I know, most of them, a lot of them is young, and they feel like they're invincible. They still get in big groups. And they say, well, Dwayne, it's these old folks that you got to worry about, is what they tell me. No, you can bring it to us. You all don't need to be gathering like that. You don't need to be, together. I heard that no longer than last night. See, so I think that's the part that we need to be working with.
All right, I think each of the council that's here, Madam Clerk, we haven't heard from you, or the attorney, we'd love to hear anything either one of you would like to say, but also, I'm going to summarize, I'm ready to begin to move on something I think will work for us with this, but I want to make sure that anybody's got anything they want to say right now to chime up, and then I'm fixing to try to move us in the right direction. Yes, ma'am. Yes, ma'am.
I've got a quick question that I've been worrying about, and I don't know if Mr. Berry can answer it or even possibly Chief Charles can answer it. How, when you look at these statistics that's online updated at noon at 7 o'clock, the unknown, is that people that they're waiting on the test to come back that's either negative or positive and they're unsure?
Most of those are verifying what county they're from, and they move that in to the spot. Each time at 12 or 7, they're moving those unknowns. If you'll notice, they'll move those up, and a lot of them will go into a certain county.
I have noticed it going up and down, but I've also noticed last night it went kind of doubled. So I was just curious as
When
That's what
people are
that was.
coming in and they're not necessarily with somebody or in a position to where they can provide information, at that point it's unknown. As
gotcha.
they are able to address the situation, get a hold of family members, those types of things, then they can find out the information.
Thank y'all for the clarity.
Can I-
Let's get a lead and go.
Say something. One thing I want to say is, from the information I got last night, Public Health is going to rescind Telford County. Telford County, that was a typo or an issue. That's what I was told last night. So that one should, 12 o'clock, if that's true, it should come off, and that county should go back to the white, so there's nobody there. That's the official statement I got last night. So there was an issue, and Telford County called that issue when they seen it, and there was a typo by Public Health, and they had made the wrong, done something wrong. They typed something and put something wrong. So that's what I was told last night. So if that is true, 12 o'clock, when the new numbers come out, that one should come off. We'll have to wait and see. I'll tell you one thing. If you look at the information we pushed out from the City of Hazlehurst, Jeff Davis County, EMA, Fire Department, over the last several weeks, a lot of people have took that into consideration. If you ride the city at night, or you look, there's not near the people out there used to be. And there's only a few restaurants still left that they're offering for you to come in and sit down and eat. Most of those have changed to either curbside, pickup, or window. I did speak with Dick's Wings yesterday and talked to them about, because they're the only restaurant we have that has a bar in it. And I discussed that with them yesterday. They were going to meet yesterday and decide where they were going to leave that open. But I told them for now that, because they're not a nightclub or a bar, they're basically a restaurant with a bar in it, that they needed to make sure they had no more than 10 people in that area at any given time. They need to have any type of events, like karaoke and stuff like that, because it draws crowds. So that was something that we talked about yesterday. Like I said, I have not heard back from them, because they were talking about the possibility of shutting that part of their business down for right now. So they were trying to do social distancing inside, but if you do an order that calls on all of them to do that, you'll eliminate a lot of people moving around. Most of the people will be in their cars going from restaurant to restaurant, and long lines sitting there waiting, to get in there. Churches, I don't know right now the churches still have a church. They're either doing something different. But now, you may know, but what I've seen, I don't know many churches that are having church, but some probably still are. It's hard to write everything in the county to see if they're in church. But that's something, to enforce the gathering, no more than 10 people, that'll pretty much lock that out. And then the churches are still having church, will have to come up with some means, following the example of other churches, either social media or Oakland. I think that's a perfect example of having a FM transmitter and everybody sitting in your vehicle and still have church. So you can still accomplish it and still have the distance between, families are going to be together, obviously, in a vehicle, but you're going to distance yourself from other families. So there's a lot of things that are in place right now that have voluntarily, the community has stepped up to the plate and done. But, we can carry this thing as far, and it's completely the decision of the City of Hazlehurst and Jeff Davis County. But my recommendation is, if one's going to do it, the other needs to do it. And the reason why is because you're going to confuse your citizens. If you lock down the city, people in the
That's
county
what
are
you're
still going to be
getting
able
to
to
do,
move
everything that
around.
lady called me about. That's the reason I brought that one issue out.
It's vice versa the other way. If the county doesn't, the city didn't, then you're going to confuse the citizens. What one does, the other one needs to do. That, I would highly suggest that, because that is good business. And all your citizens are on the same page. But, if you look, and I've looked at some of the declarations, some of the cities and counties have just done a declaration, a very simple declaration, and left it to their discretion to come back and interject points in there. Some people have wrote a long declaration that involves everything they want to do. And it's from the fact of asking people that are, have underlying issues, and people that are doing cancer treatment, things like that, to stay home. If you're sick, to stay home. Some of them have went to the point of, closing restaurants down. A lot of them have made sure that their restaurants are no longer going to do anything but drive-through or curbside. So there's a lot of things to take in consideration you can do. Essential businesses, you're gonna have to decide if you lock down, are you gonna let essential businesses that are, industry. I got a call yesterday from one of our industries, and train has been assigned as an essential business or essential factory because they make heat and air conditioning, and they make filter systems for air conditioners. So they are now calling all their folks that they buy from, which McPherson is, builds a lot of product for them. So they're calling them saying, listen, we've been deemed essential, so you're essential to us. So if we're gonna continue to operate, you got to continue to operate. So they're providing those letters to their employees. And the question to me was, do we need to provide them to ours? And I said, well, have your letters ready, but I don't know. Right now, we've made no move to close anything down. So those are the type of decisions you gotta make as well. Are you gonna allow those to stay open and still produce because they have been deemed essential? So a lot of decisions to make.
I don't think we have to quiz anybody in here about how prepared they are, but I do think that we have a responsibility to take the pressure off of our healthcare people. And we need to make a decision and err on the side of caution and common sense and send people home.
No, my ignorance is vast, but I didn't know that we were being as proactive as you just suggested. The fact that you've already gone to some restaurants and asked and requested that they make sure that they adhere to the 10 in a group, and I commend you for that.
Yeah, but my thing is, not all of them have done that, so
Yeah.
I'm just telling you what is voluntarily been done. Y'all have the right to do a lot more. And that's the thing, but my thing is in this declaration, if you're gonna do it, you gotta make some decisions on how deep you wanna go with it. Or if you wanna do everything and shut the whole city down, then you shut everything down, other than fire department, EMS, and police.
What do you recommend?
There's some counties, there's one county, like Charlton County, they've had one for a week and they've done, they haven't had any more cases. There's one county in the state that has several cases, and they just done a declaration yesterday. So, my recommendation to begin with was not to do a declaration until we seen we had an issue, but that can be, that only helps business. It doesn't help health department or public health at all. But there is a lot of different things that are going on. That's the sad thing is, a lot of different cities, there's nobody doing it completely alike. I mean, everybody's doing it completely different. If you look at their declarations, if you pull up a lot of other declarations in the state, they're completely different. Some are, the one over in Coffee County is very simple. It's just a declaration from here, from this point to this point, we're declaring a state of emergency. Then the county and the city comes back and puts in provisions in it. So,
How is our social distancing affecting that of confinement, such as the jails and law enforcement that we may have? And saying that if we enforce the fact that they can't be parties of 10 in some of these restaurants, are we going to overfill our social distancing in that point?
well, I mean, there's some areas you can't, I mean, like, you look at the jails, there's no way, I mean, they've got, there's no way to take 44, and that's what we had as of yesterday, was 40, I believe, 44 people in the jail. There's not enough room there to put all of them within, away from each other 6 foot, so they're having to do the best they can. The problem you have is you got 90% of the people, 70% of the people in this county that are they're using common sense and doing what they need to do. But you're always gonna have that 30% that's not gonna do it. And the only way to make them do it is to make them do it.
And I think we need to set a
What are you
precedent
gonna
to
do about
that.
30% that won't do it? What are you gonna do? I mean,
You set an order, and then you set an order, and the order has to be enforced by the police department and the sheriff's department.
That's what I was getting at. you got that 30%, you're going over capacity of the jail. Sounds like we're at capacity right now. And this is a minor thing as far as things that have been done to be put in the jail to start with. But are we gonna have a different place of confinement? What are we gonna do to keep them apart?
I think you'll have more compliance with this issue if you set a precedent. You'll have more compliance than you will non-compliance.
But if the police department can write citations without incarcerating.
Yeah.
And issue citations, and then those citations come before the judge or before a jury, wherever they elect to carry it. And then you're dependent upon the jury to enforce it. And if we can get our people to acknowledge that when they come there, they're going to enforce it, that will take care. You won't have so much incarceration. One thing that I want to insert there, I know you help people, certainly, I'm very concerned, facilities that they have, equipment and other things. But we've got half a dozen men that ride garbage trucks every day, that pick up every kind of filth you can imagine that everybody everywhere is dispersing, that not only with the virus we're dealing with now, but other very contagious diseases and so forth. So finally, I took enough courage to call the supervisor and stop them and pull them in and put on additional gear, and gloves and protection to try to help those people and tell you the truth. Some of this sort have already been done, not only because of this virus, but other contagious diseases as well. But those men subject themselves to a tremendous exposure every day. And yet, I don't see that we are going to ever say we're going to let the garbage pile up out and the dogs turn it all over town. So that too, as with you health people, is something that we've got some people that's got to be there.
Mr. Baker.
Yes, sir.
How can, the mandates that are coming down from the state, I know as a member of the health board, that was the main thing that I asked the doctor. I don't know if you ever get not to the last health board meeting. Yeah. And I asked her, now how are we gonna approach our people, whether the city or the county, what is expected of us is what I asked her a couple of weeks ago. And what she said at that time, that we would follow the mandates of the governor of what the feds send to the state and the state decides to do. If we get marching orders from them to do a total quarantine, a total shutdown of the city, is what we should be doing. My thing is, that's what we've been operating on, is what we listening to coming out of Atlanta. Atlanta was supposed to be listening to the federal. Then we won't overreact. But what do we need to be getting ready? This is what I'm as for me. What do we need to be getting ready as a public to help our medical people with the knowledge to handle this when and if it does come, so we don't react? That's what we've been working on. Do we have anything in place for that? I reckon I'm saying the right thing.
I guess if I'm understanding your question correctly, yes, that is the appropriate methodology in regards to how we're supposed to respond to, especially to a nationwide circumstance. Obviously, the federal government sets the guidelines, the state government can take those guidelines and modify them in regards to what's going to work for their areas, as long as they don't supersede those guidelines. And then obviously local communities, same way as it continues to go on down. First of all, you made some statements earlier, or had some questions earlier, that let me answer those as I move through this. Through the healthcare system in itself already has many safeguards in place of how to handle situations like this. First of all, we have a hospital association, the Georgia Hospital Association, that runs a bed board. So they are looking at who, in fact, I just filled out a survey yesterday, how many potential beds that currently aren't beds could you put somewhere in your community or facility that you could staff? What equipment would it take? How many people would it take? You know, they're looking at all these questions, trying to figure out, if you're overblown in that hospital, where are you going? Currently, we're part of the network, so if we have patients that need to move to a higher level of care, they're going down to Douglas at Coffee Regional. Coffee Regional has 14 vents and about 15 negative air pressure rooms, obviously a much bigger facility than we are. From there, if that gets overloaded, the next step's supposed to be going to Memorial Healthcare in Savannah. They've got 700 plus beds and all kinds of resources available to them. But y'all, all we have to do, if you ask me, take a look up at New York right now. And if you're, I'm trying to be very respectful here, but if we want to say we've got to first look at the nation, at the federal government's response and then the state's response, can we say that the federal government's response has helped New York whatsoever? I don't want us to be in that circumstance. Right now, 1 out of every 1,000 individuals in the state of New York is deemed to have COVID. You're talking 25 million people. They're going to have more cases than they can possibly take care of right now. If this goes the direction they think they're going, I don't want that to be the case here. And people are going to probably be saying, man, this guy, he's going way overboard.
All right.
And maybe I am, but I'm sorry, Mr. Mayor. Let me point out, I lived in Savannah for 9 years. 2 times during that time period, city of Savannah evacuated Savannah for hurricanes. Both of those times, that hurricane skirted Savannah and went up and hit the Outer Banks of North Carolina. They displaced 550,000 people out of that city for the concern that they are going to have a catastrophic event hit the city. And guess what? All those people came back, resumed their lives, and kept on going. But they are very appreciative in the fact that their city was looking out for them and making sure they weren't in the path of a disaster. You all have a very, very tough decision to make. There's an economic impact to this. I'm not taking that lightly whatsoever. But all I am saying is, in my opinion, based upon what I'm seeing statistically and what I'm hearing from other states, we've got to take this extremely seriously.
Yeah, okay.
As I understand it, they want these limitations in place unnecessary for approximately a 2-week period of time. We're not talking about indefinitely, is that correct? Because that's the period of time.
As far as quarantine, is that what you're saying? Yes.
So, because that would help level off the incubation period, and it's not going to stop the virus, but it's going to level it off where it can be handled better. So we're not talking about a measure that's going to be permanent until it's revoked. We're talking about a 2-week period of time.
Well, let me say this now. We're 1 week into that 2-week period, so now it's probably moved out of another week. So I think we'll get into that. Let me make a little move here to get us started, because this can go on and on and on with all these issues. If anybody's got something in the preface here that's hot on their mind, let's hear it for a minute or so. Good. All right.
I just would like to say that I want to see fair treatment and correct treatment for everybody. That needs to be the deal. We need to be uniform in the county and in the city with everything we do to protect our people.
Okay, with that, I think we're at the point that I want a motion that we put forth a resolution with all of our entities that we're going to get to things that you may want to add or subtract from it. But I entertain a motion that the city of Hazlehurst enter into a resolution with issues pertaining to the safety of our people. Now, as we begin to look at the various ones that I've handed each of you, and as we look at our own and listen to our people that's advised us, we may add to some of what the other communities have done, and we may take away from what's the other. But I want to first entertain a motion that we enter into a resolution with issues including those that will protect our community in this health issue.
I'll make a motion that we do what is necessary to protect our citizens.
And institute a resolution in effect.
A resolution.
All right, is there a second to the motion?
Yeah.
Any further discussion of the fact that we're going to enter into some type of resolution with certain criteria? Hearing none, I call for the vote. All in favor, say aye.
Aye.
Any opposed? We are unanimous in the fact that we are going to adopt a resolution. Now then, Mr. Attorney, you've got the council, where is this thing that, so that we can start eliminating, where is it, Jessica, right here? All right, do we, in doing our exclusions, thank you, buddy, I'm sorry. I've got a list of places now. Do we want to, gyms? We've got some people that register for self-improvement athletic gyms all around town. Do we want to exclude or include? If anybody's got any opposition to it, if not, we'll move along. Gyms?
My question is, you're talking about shutting it out completely?
Yes,
It's not limited to 10.
yeah.
That just needs to be clarified.
Okay, nobody's got any objection to that. In fitness centers, pools, certainly nobody's going swimming yet. Social clubs, what about the Rotary, the Kiwanis, and other club meetings?
Kiwanis, as being a member of the Kiwanis Club, we've already shut down meetings already.
So we can all agree that the social clubs should discontinue their meetings, and that would include PTAs and other organizations.
Retired educators
Yes,
have
sir.
also done the same thing.
Okay, all right.
We've seen it.
Oh, just,
Can you ask something, doesn't it? So that the public would know this is mainly with the 2-week period and then we revisit?
no, I was going to get to the time period. I think right now, with what I'm hearing from our professionals in my 2.5 hours of phone calling, I had 2 or 3 calls in Atlanta. What, dear?
That's what everybody's recommending.
I'm recommending April the 15th. And we get to that. I was going to get to that later, but okay. While we're talking about this, we'll handle this. If y'all got a better date than April the 15th,
I think that'll work. I mean, I think that's fair.
all right.
Mayor, with all the research that you've asked me to do to help, and thank you for allowing me to do that, you have actually extended it an additional 7 days with everything that I've seen on all the cities.
Don't you think that'll be okay?
Yes, sir.
I've decided last night with my struggles, but again, here again, y'all are the boss. I'm just one of the cops and the spokes in the wheel here. If I don't hear any opposition, let's right now, and if we find that we need to correct it later, we'll do that. We can come in and amend our city. Let's determine that we're doing this till April the 15th. Is everybody in agreement to that? Everybody in agreement? Good. Let's move on. All right, now we've got to amusement facilities. We don't have any bowling alleys, pool halls. Got a pool hall or 2 around the county now, Commissioner, but it's outside our jurisdiction, it's in yours. Theaters, skating rinks, community centers. I think by all means, we've got a civic center that we rent consistently. In fact, even this weekend, we had a little problem with utilities out there, and I didn't have water, and I had to hurry up and do all sorts of things to get water to them. So I don't think we can rent our facilities to anybody. In fact, if anybody's got it rented now, we're gonna have to, they're gonna have to cancel. They'll have to cancel, because we just can't do that. Okay, we're doing good so far. So, Mr. Attorney, all these things that they're approving on, we want you to take it. We'll get through the other items of various issues here later. But let's go on community centers, bars. Y'all, I like a little scotch at 5
You need to
o'clock.
stay
Go to
home.
your house.
Y'all, I'm kidding you. Nightclubs, parks. We're gonna close folks going to the park and walking.
You're gonna have to close them. I mean, this is serious.
I see some folks nodding their head. Our parks so far, recreational facilities, massage parlors, tattoo parlors, hair salons,
Some have already done that.
All right, I see a little opposition to hair salons.
Most, in talking with,
Listen, I could find one of those old Tonys somewhere and get that old stuff and sock on. If y'all need a Tony, I'll come give you one.
most of your beauty shops, I think, have actually begun shutting down. They've been proactive there.
Barbershops, nail salons. Y'all pretty well closing down everything now.
Well, I can assure you it's not fun to do it, but it needs to be done.
All right, under the, this thing is the restaurants and eating establishments, takeout only? What about the drive-through and takeout? Okay.
According to the Hazlehurst Jeff Davis Chamber of Commerce website, and they've updated this pretty well daily, most of them have went to curbside, takeout, delivery, and that's it.
Just, no, that's coming from my department. They're sharing it as we update, but my department is putting that list together.
Thank you, sir.
Now, with drive-through and takeout, you've got to remember that some of our mom and pop organizations do not have drive-through where they can reach out through a car window and hand them something. So I think probably we need to include, since we're include curbside.
Yes, sir.
So curbside will handle that at all times.
That would include, I know films like mine, I think they call in, they go in and pick it up, they just can't stay.
Yes.
They don't have staff to keep somebody outside, that's fine if
That's the
somebody's.
takeout. If you wanted to eliminate that, you do curbside and drive-through only, and you'd eliminate takeout. But if you want to leave the takeout in there, that's where they can actually go in.
Okay,
and
so
go in one at a
so
time
we're
and come
in
back out.
agreement with this for mom and pop places like me. Okay, that's good. All right, I'm gonna give you your instruction, then it's you get your book, you know, that we fixed to get this thing pulled.
Well, I think Popeyes is allowed to take out. I saw signs in the lobby open for takeout.
Only.
Okay.
Is that all okay with you, gentlemen? Okay, all right, good. Let's move on. Let's get things done. Let's see.
Let me interject something, just not from a legal, but from a health standpoint. If they got to drive in, it seems to me it'd be better to make them use the drive-in. Because doesn't this virus stay alive a long time on metal and everything? You know, you're in there handling those rails and everything. It's not gonna hurt somebody's got a takeout to restrict them solely to takeout. If somebody's gonna go there, they're gonna drive through, but it's gonna hurt the ones that doesn't have takeout. But again, I come back to man, and I'm not favoring man, that's just who comes to mind. They don't have the chrome counter and everything. You walk up, pay and take your food, you go out.
Yeah, it stays on stainless steel a lot longer than it's metal.
And here again,
And that's
we're
where
trying
there's
to
a lot of
help.
stainless steel in restaurants.
How many people's gonna be walking in and out if they have 100 customers, got 100 people to walk through that door and out that day? Whereas if you, even if they, we let them continue an operation, I'm for them now, and I'm thinking about another one besides what you mentioned. They can call it in, and they can take that one employee and go to the door, and then you don't have all that 200-some people in and out of that thing. So I don't think, as much as I love, and I don't care if they come to see this thing that's putting on there, as much as I love them, I don't think I want them to continue to have the patrons, but I think that with that many people walking in and out of that door, you're creating a tremendous problem. All right, that's one touchy thing. We'll all chat about it a little bit more, but let's decide it though.
I say let's address it while we're here. Shut it down and make them take it outside and give it to them.
Well, in thinking this through, they're gonna have waitresses, it's not wait tables anymore.
Right.
They can assign just to the
And encourage, if somebody brings you a takeout out of one of these bottom pop things, don't forget to handle a very good sized table. Maybe not. Let's listen to my recommendation, and I hate to do it, but since we're doing this, I think having that many people trucking in and out of that door, and one, the door handle, one person hits it, the other, I think you need to stop that.
I agree.
Okay, all right, so Mr. Attorney, you got that. All right, let's see, we've gone over all these things, and as far as McPherson, yes, sir. As far as
We
McPherson.
talked about that too, is McPherson one example that you gave was an essential, because of what they're making to supply, some others. What other, businesses or companies do we have that would be classified as essential? And are the ones that are not classified as essential, are we gonna say that they need to refrain or cut down their employee numbers to the 10 within a group area?
Well, okay, let's just get to it. Beasley Forest Products is two real big areas.
That's a big one, yeah.
I think I seen where the governor had, issued a statement that the wood industry was an essential. I believe I seen
Well,
that.
they related all that back to toilet paper.
I heard that.
Yeah, but maybe that's the case, because they need toilet paper.
Pharmacies. That needs to be.
Okay, we'll get to that then first. Grocery stores.
This is what most of the sites have been saying, Mayor. Grocery stores, pharmacy, and other businesses which remain open during the emergency must post signage on entrance doors informing customers to maintain at least 6 feet of personal distance between themselves and others. If social distancing cannot be maintained, not more than 10 people may be allowed in the establishment. Also, they have to post it on their doors that they have got to remain 6 feet apart. Is that correct, Chief Wonston?
Yes.
All right, could we have, requirement that they wear gloves when they enter the facility?
It'd be hard to enforce.
Yeah, I mean, some people won't have it.
We're already limited.
They're
on
very
supplies on that
difficult to get a
already.
hold of right now.
And they're difficult to get a hold of? Well, just the same, when you got that many people going through the grocery store.
They already have an hour.
Hey, but I'll tell you what, here's the way we might word it, and here again, y'all help us prevent it. I think what I'll do is, I've got some at my house, and I can buy a pair or two. I think I'll wear a pair when I go. And then, and anybody that will voluntarily, if some don't have gloves, so they're handling, that might protect, but, y'all help me now, we're in this together.
Can I interject something here?
Certainly.
I think that the panic buying has slowed down.
No, it hasn't.
Well, I think it slowed down some, because I seen bread at Piggly Wiggly last night at 7 o'clock, so that is, something I ain't seen in a while. But when we do this, you're gonna see it pick back up for a little bit, because people are gonna panic again. And, I'm just telling you ahead of time.
Let's go ahead, being we're live, and tell people, don't panic. We're
Yeah.
doing this to help you, to stay at home, not
And,
from a place of fear, but just caution.
Mary Ann, you can get this on our, network as soon as you can get out and get it together. If you would call me and let me read over it with you.
When you look at all these ordinances and the governor's thing, it's directed primarily at businesses where people congregate and stay together, is the way I see it.
Right.
Like a convenience store, gas station, they in and out. And you can't shut that down. You gotta have that in the grocery store. And from what I've seen, a lot of people are proactive. I mean, you see people doing this with hand sanitizer, people with masks and everything. So, I think you've got to be careful to distinguish between where people gather and stay gathered versus the in and out. Not talking about takeout, I'm talking about.
Yeah. Okay, then we've got the, places and centers where we congregate, the grocery stores, we've discussed that, about that, pharmacies, medication, the doctor's offices, if someone's sick, naturally, they've got to go there. How about taking now, the, information that we've gathered, and, let's instruct our attorney to, as soon as he can, get this together for us. And, do you know anything we need to bring before this group while we're together?
I'll try to
I like to stand there speaking, they fuss at me about running my mouth. If you'll notice, I normally have a 1 hour meeting, you start on time and stop.
I'll try to have y'all all draft by this afternoon review to look at and cover. Pretty much it's gonna mimic the Jessup ordinance, what it looks like. We'll be a little bit more detailed to find out from that standpoint.
And what I'll do, as soon as he gets it to me, I'll get it to each of you. And if you got any suggestions, I'll see that we together And the Barry, make sure, yeah, I'll get it to, in
He
fact,
gets some-
anybody, oh, yeah, okay, just a minute. I'll get it dispersed so that again, Ken and I will do our very best to see that each of you have all the input that you want into getting this done, and including, the hospital administration. Yes, sir.
Again, just pointing out something that, in my opinion, could be an issue. In Daughtry County, the cause of the virus establishing there was a result of 2 funerals. Up in Noonan, where they have 100+ cases, theirs was a result of 3 churches getting together and having a joint meal. And out of that, 40 of those cases came from that meal. I think we need to look at gatherings. I mean, and as crazy as it sounds, weddings and funerals. Coffee County just implemented funeral, maximum of 10 people and family members. You know, nobody outside the family. That's,
I haven't seen
That and
anything.
blocking off the roads, even to keep people.
and I'm not
from
saying you
there
have to be that specific or that disciplined, but I
it's-
think we need to look at those mass gatherings. That's where this tends to really
I
percolate.
think, Mr. Attorney, please include, get your area in there for weddings,
That's
funerals,
in the pattern ordinance that PMA has suggested.
That's
I'll
correct.
cover all that.
cover that, okay.
I'll tell you that we had already started that, Wainwright and Pollard already started that. Coffee County inmate called me and asked me about it before they made a decision. He asked me what we were doing. I said, our funeral homes are already doing this. So they kind of,
So y'all are ahead of the game. That's
so
great.
we were ahead of this. They made that decision. He said,
That's
I'm
great.
trying to work my funeral homes, but they're not, there's some of them not want to listen. He says, I said, well, this is what we're doing. And I said, you know, we're having one pastor that, you know, that will go with the family to the graveside. They'll have immediate family, usually around 10 people, and then they will come back and offer another service after this is over with. So
Well, I've
I think
just
that's
experienced
kinda
that in
what
my family. I had a first cousin that died last week in Abbott County, and the family, in light of this, the immediate family took care of all that, and none of us, we're a big family, none of us, only the immediate family, him and his children, took care of that. So we're exercising it personally, just to give you an example. Okay, any further instructions we need to get? Yes, ma'am.
Who is the official source that I go to for Facebook and the newspaper? You or you?
For what? Wait a minute.
For numbers if it hits here.
I tell you something I did like that I seen yesterday on Facebook. Did y'all see what My Day Hospital was doing? Little thing they done where they said, we
Yeah.
tested this many. That's pretty helpful. That
Yeah,
gets it out to the.
we're actually
Yeah, that's
working on
great.
Okay,
putting that together.
here's what I'm
That's
gonna
good.
suggest, since this monkey is on our back, Barry, I'm gonna ask you and your staff, whoever you want to designate it, to keep Ms. Verdes posted on, with those figures, and she will discreetly, you tell her if anything should be restricted, but if you'll communicate with her, then we can go to her desk, or you can call her desk, and let that be a central place of location, and anything that you don't think ought to be dispersed, keep it within your walls. But let her be your communicator. Would that suit you? Okay, Mary Ann? Okay.
And just-
Any council got any objection to
When you
that?
put something in there about the church, I'm serious. I know several, mine in particular, that is definitely not wanting to stop having church.
Lord,
We just need to put
Lord wanted
something
me to
in
die, got to go to church. They go get their butt there and get killed.
there. Well, anyway, with it's
Something
been
needs to be
requested by
addressed.
the,
They'll abide by an ordinance though, won't they?
yes,
Okay.
they want something written so they can.
A lot of these are coming from churches, Bartow County, same thing.
Church.
41 people.
Yeah, that's right.
One person in the choir infected everybody in the churches, one church, over 41 cases from that one church.
I have one
Mary Ann,
more
you
question.
might, excuse me, Mary, you might take an example and say that recently, in order to get the attention of them, that one person at a funeral spread it, make it short and sweet. You know how to do that. And give an example to encourage people at funerals and weddings, how one person can do that. So,
I think it's important too, as John pointed out, me and now, is that we're being proactive. We don't have any cases.
that's
That's a good
right.
thing about being in rural Georgia, and there's very few cases surrounding us.
And we're trying to
We're
prevent.
blessed, and we're being proactive with that.
And you wanted something, I interrupted.
Do we need to enforce a curfew?
That is up to y'all. But that you have the right to do that.
I feel like it is necessary.
A lot of them's doing 10 to 6, or 10 to 5, 10 to 6.
I would say so, 10 to 6 for non-essentials. It's understandable if you work a night shift job and you've got to get back into the work.
All right, hold on just a minute, folks. Hello, Robert. Yeah, look here, let me first of all tell you, I've got a little gathering here, we're discussing our problem, and I've got you on speaker, but I'm sure glad you called.
That's fine. Don't take the dining room as long as we do 6 foot social language. We got them all marked off now. You can't sit by nobody.
I think, Robert, we've already done that.
Really?
Yeah.
You already took the dining room?
Drive-through, takeout.
You got people like that who don't have a drive-through. We're gone. We're out of business since it goes in effect.
Explain again that they can go in and get or take
No.
out.
All right, we're okay. You've let your, and you know I'm your friend. You've expressed yourself.
I know y'all gotta do what you gotta do, but my question is, what's the difference in going to Walmart with 800 people in there and coming in my restaurant with 10 in there, scattered 6 feet apart?
Okay, all right, the council's listening to you, so your timing is perfect.
Well, I mean, just tell me the difference, and everybody's gonna say, well, it's different. Well, no, it ain't. I mean, I go to Walmart, go in there, and there might be 600 people, and you have to find your way in there, man. But I'm just saying, if you take the dining rooms, which I don't have any problem with the 6 foot social limit, we already marked our table off yesterday, every other table, and no big tables, and none of that. But when you take that from sit-down restaurants, they're gone because they're not set up for drive-throughs, you know what I'm saying?
Yeah. All right. Your call.
I don't have a problem with Captain D. We can do drive-through all day long because they set up for drive-through and people are used to going through drive-throughs. But the sit-down restaurants is what is going to hurt. And I know we can have cases. We don't want to have cases. I mean, I agree with you. But to be honest with you, the restaurants right now are the cleanest they ever been in the history that I've been in the restaurant business.
All right.
I've never seen, we sanitize every 20 minutes.
We made it a takeout, we haven't shut it down.
All right.
We used to do what we're doing now, the way they do now.
Yeah. All right. Well, your call was perfect, buddy. We're discussing that.
It's clean and big because it's going to put us some business.
All right. Okay. Thanks for calling. All right. Let's proceed.
I was hoping you was gonna ask him about the point that we've just talked about, is that a takeout, how it's gonna affect him if we do shut the.
Well, he can take the waitresses, he can do the same thing that we've just done there. He can take the waitresses, they can call in and carry it to the door.
Take it to the door.
That's what we've already
That's what
decided.
we decided.
That's what we
And
already
I don't
decided.
think that it will damage him.
It will, because I'll let
It
go.
will,
I'll
but
let
it
go and
won't
sit down
damage
and get that girl to come refill that cup of coffee, and I enjoy it, Huddle House. I'm a regular customer. But it appears if I've got to have Huddle House, I'll have to get it takeout, and I'll have to drive out there, and they'll have to walk up and hand it to me.
Well, it's to April 15th, it's going to
That's
be
right.
hardship on everybody,
It is.
but you got to be done.
And it's like that fellow right there, and he and his daddy and his entire family are a close friend, but I can't treat, if it was my son, it won't make a difference with me.
We got to be fair, one to all.
Okay, Mr. Attorney, you've got your assignment. You say you'll try to get something in our hands before the day's out. We appreciate you being expedient with it, and do the best you can. Members of the council, I'll see that whatever he gives me, you'll have it as well, and we'll hash it over. Ladies and gentlemen.
And other than this, is that
Curfew.
all the support that the medical establishment needs right now? Or with us trying to be proactive? That's all y'all need right now?
I think that and, prayers, I think, is very beneficial as well. But we're struggling to get medical supplies at this point in time. We're working with a lot of different folks trying to make that happen. But as far as community support and the support in regards to the council. I think y'all have helped a lot just in your discussion that you've had today. And we appreciate all that you do.
Well, we appreciate y'all too. All right, before, just a minute, before, I'm sorry. Go ahead. You got some, okay. All right.
I've got a question here on Facebook Live. When is this going into effect? Is this immediately? Or is this going in at 6 o'clock, 9 or
Going
when?
in effect.
You will have to be past it.
Yeah, that's exactly right. All right, we'll gather, can you have it by 6 or 7 o'clock?
Best.
Gentlemen, y'all are the boss. You want to meet back at 6 or 7 and approve this and get it enforced?
Meet back and get it enforced.
All right, as soon as Mr. Attorney gets through, let's
If he can get it done, well, then we can do that.
If you,
not,
right
have to do the
now,
first-
tentatively, this is an emergency. I'm gonna say that we have an emergency call meeting at 6 o'clock this evening. Sir, if you can't make that, if you can't make that, I'll change it. All right, wait a minute now, now there's one other thing. Oh yeah, I entertain a motion that we establish a curfew from 10 p.m. at night to 6 a.m. in the morning, 7 days a week.
Before we get that as a motion, let me ask the question of what businesses such as Walmart, what time do they open their doors? And they're,
Except for emergencies.
I think there were also some places that were opening for only the elderly.
It'll be 6 a.m. would be the earliest. 6 to 7 for Walmart on Tuesdays.
And they're closed at 8:30.
Yeah.
So
Yeah, they come closed at 8.
Yeah, so if you said at 6 o'clock, I mean, they're gonna be open 1 hour on Tuesdays from 6 to 7 for elderly. So that's the earliest Walmart would open for that one day. Other than that, they're open, I think, at 7 p.m.
Now, these curfews gonna involve the gas stations and all?
Yes.
It's gonna involve everything.
We're making that decision. That's our,
Well, let me interject here. He's brought up a good point.
except for emergencies.
You've got truckers that are on the road that.
That's essential.
That's
That's
Truckers are
essential.
essential.
Using common
They
sense.
are essential.
Okay.
But then you're gonna have to, what about your 24-hour stores that's got diesel, so they'll have to stay open?
Yeah, that's essential.
Do
Yes,
that.
that's
They'll
essential.
have to be open.
I mean, your curfew's limited to people just cruising.
Right.
Right, exactly.
Specific business. got to be
Exactly.
done.
If it's essential or an emergency, accepted. If it's essential, which are truckers and all,
Right.
or an emergency, that is accepted. I'll have to talk to you later.
Ken, do
I
you
think-
see anything in enforcement that needs to be brought to our attention that's gonna cause you or enforcement people a problem?
The, number one, who is gonna enforce it? And number two is what are the penalties if you don't abide by the declaration that y'all are drafting?
Definitely need to address this.
That, yeah.
That's the
I
reason I
may
called.
have to get with the city judge and see.
And we might have to talk to him before it's all over. But also, Mr. Commissioner, you need to consult with your people and with the sheriff too as well. And you can bring them up to date, or they can consult with, we've got people here that have it all recorded, they can refer to it. I want to get this curfew thing worked out. I entertain a motion that we establish a curfew from 10 p.m. at night to 6 a.m. in the morning for all circumstances other than essential needs and emergencies.
I make that motion.
Second.
Motion made, second. Any further discussion? Hearing none, call for vote. All in favor say aye.
Aye.
Any opposed? Motion carried. Okay, we're adjourned until 6 p.m. this afternoon.
When do you want this to go on Facebook, after 6 o'clock?
No, you can go ahead and announce what we're doing. We met and you know where we are. You know how to.
Well, I have a doctor's appointment in Douglas, so maybe it's a little,
I think it'd be better to put it on afterwards.
She's already got it. It's already on. You take and do what you want to
just
do.
take hers
Kim.
and share it.
Yeah, however you want to do it.
Rhonda,
It's gonna be a local.
is that already live?
Okay.
Okay.